Hello, good afternoon. We will get started. So we are going to do the review for test number 3. And if there's any additional questions that you might have, please feel free to let me know. Okay, but we're just gonna go through this list of questions first. First question: give 3 examples of long bone. Right, so we talk about how we can classify bones based on their shapes, and if they are rectangular in shape, then we can call them long bones. An example of long bones would include things like the femur, the humerus, and things like the metacarpals. Okay, of course, there are other examples as well, but these are easy ones to remember. Next one, list 3 types of movable joints and list an example of each. So we have things like ball and socket. And an example of ball and socket would be the shoulder. And another example would be the hip. So that's one example of movable joint. Another example of movable joint would be the hinge joint. Hinge joint. And example of hinge joint would be the elbow and the knee. One last one would be the pivot joint. And that would be C1, which is the atlas, and C2, which is the axis. Okay. So atlas and axis. So those are your 3 examples of movable joints and where you would find them in the body. Just want to remind you, in addition to movable joints, there are things like partially movable joints. That would be things like your backbone. And then there are also immovable joints, which would be like fissures in your cranium. Next question, list all the bones in the arm from the most proximal to the most distal. Okay, so you would have your scapula, which is your shoulder blade, and on the side you would have a socket for the humerus to go into, right? So scapula. This is called a glenoid process. And there is going to be your humerus. Okay. And distal to the humerus would be 2 bones. Okay, so the one that is on the lateral side, the one that is further away from the shoulder, that would be the radius. And the one that's closer to the midline, that will be the ulna. And then you would have your wrist bones here. They are called the carpals. Total of 8 carpals. And distal to that, I think I draw a little bit too many here. That would be your metacarpals. Five in total. And you would have your finger bones then. Okay? The finger bones are called the phalanges. Total of 14. Okay, so that's all the bones in the arm. Technically, the scapula is not really part of the arm, but you know, it shows the connection point, right, for the humerus. So that is that. Okay. All right. Next one. List all the bones of the legs. So same situation here, basically. You would have your pelvic girdle. Okay, and on the side of the pelvic girdle, there is going to be a socket here, right? You might remember that it's called the acetabulum. And that's where the head of the femur is going to fit in. Okay, that is a femur. All right. And from there, we're going to go down. Oops, sorry. We're going to have our patella. And then we will have the tibia. Okay. Sorry, I should label here tibia. And on the side, there's a small bone. Well, not really small, but like smaller in size, in thickness compared to the tibia. And that's the fibula. Okay. Instead of having the carpals, we would have the tarsals. Okay, so there's a big one right here. Does anybody remember what the name of that is? One of the 7 tarsals that you have, and it forms your ankle. That's okay. That would be your talus. Okay. And then you have smaller bones here and a big one at the back. That's the heel bone, calcaneus. And then you would have your metatarsals. And finally, you would have your hose, which would be the phalanges. Okay. That's all the bones in the leg. All right, number 5, list the different sections of the vertebral column and number of vertebrae corresponding to each section. So we have the cervical, which is 7. That's in the neck area. Thoracic is 12. Lumbar is 5. And then there's the sacrum, which is just one big thing. And then you have your tailbone. Coccyx bone, which is 1 to 3. Okay. I think I spelled coccyx wrong here. Sorry. Coccyx bone. 3 to 5. I'm sorry, 3 to 5 fused bone. It's together. And the tailbone. We have just ×1 sacrum right here. Okay. Okay, next question. List the 3 parts of the sternum. So your sternum looks like this, right? kind of like a pencil drawing. The top part is the manubrium. Followed by the body. And then we have the xiphoid process. And that's where the diaphragm is going to be attaching, right? So you have your first pair of ribs going there. And then the second pair of ribs, it's kind of, you know, in the interface between the manubrium and the body. And then you will have all the first 7 pairs of ribs connecting to the sternum, right? Okay, so in terms of rib classification, we would have a total of 12 pairs of ribs, 7 pairs of true ribs. Okay, which means they either directly connect to the sternum through cartilage. And how many pairs of false ribs do we have? 7 pairs of true ribs, and then that's right, we have 5 pairs of false ribs. 5 pairs of false ribs. That's okay. Yeah, false ribs. They don't have their own cartilage, right? They connect to the sternum through cartilage of the 7th pair. Okay, so they don't have their own. They just gonna piggyback right on the 7th pair. Except for 11th and 12th. Okay, these are floating ribs. Okay, so of the 5 pairs of false rib, 2 pairs are floating ribs. They have no connection. No connection to sternum at all. Okay. Do you have a question, Gawinda? I saw you unmute. Okay. Next, we have the bones and features of the pelvic girdle. Just give me a second. Just gonna hold one up here. So we have 3 bones here, right? That makes up the pelvic girdle. The hip bone is what we're focusing on. It's actually called the coxal bone, right? Coxal bone. And the coxal bone, which is like the whole thing right here, is made up of 3 bones. Right? So let's just label them here. We have the ilium. We have the ischium. And the pubis. Okay. Now at the front, connecting the 2 pubis on either side, there is a bit of a cartilage there. and that is the pubis symphysis. This part here that forms a crest, that's called the iliac crest. All this is in the notes, by the way, right? Like we're just reviewing here. There is the socket right here. The socket for the femur to fit into it. And that here is called the acetabulum. Acetabulum. Okay, that's where the head of the femur will fit in. Forms a ball and socket joint with the femur. Okay. There's another thing here. This is the obturator foramen. That's for like nerves and blood vessels to pass through down to the legs. There's a round knob here that we are sitting on. That's called the ischio tuberosity. Okay. That's all the features of our pelvic girdle. Okay. Does anybody have any question? Okay. That's good. Name the bones that forms the different side of the eye socket. I'm just going to show you a picture of this. Okay, so those are the 7 bones, right? We have the frontal bone, excuse me, frontal bone that forms the top of the eye socket. The sphenoid bone is at the back, and you might remember at the top of the sphenoid bone, there's a groove where your pituitary gland is going to fit into. On the side, we have the zygomatic, which forms the cheekbone. Okay. In the middle, we have sort of 3 bones. One at the bottom that forms the bottom as well. The maxilla forms the bottom. But if you trace it up, it's going to form the medial ridge of your eye socket as well. Behind the maxilla bone, we have the lacrimal bone, 2 of them. And then behind that, you have the ethmoid bone, 1 of them. Now, you can't really see it, and you might remember we talked about this in a lecture. There's just like 1 tiny spot here. That corresponds to the palatine bone. But of course, the palatine bone goes all the way down and forms a U shape, right? Like that. And that's part of your hard palate, right? Forms part of the hard palate. Okay. And that's the bones of the eye socket. No, 7 bones, right? The nose is not part of it. Right? So 1, 2, 3, 4, 5, 6, 7. Yeah. Nose is just like there for reference, I guess. Okay. So all of them are 2, comes in 2, by the way, except for sphenoid. Sphenoid is 1, maxilla is 1, and ethmoid is 1. Everything else is 2. Frontal is also 1, actually. Oh, actually, there are more ones than two. The Palatine is also one. Okay. This bone forms your heel. That would be the calcaneus. Okay, I can show you a picture of calcaneus. So you have an idea of what it looks like when you study. There we go. That's the calcaneus at the back, okay? Next one, this bone connects to distal end of your tibia and fibula. We already drew it out earlier. It's the talus. It's one of your tarsals, right? Let me see if I can find a picture for you as well. Right here. There we go. Okay, so you can see right here, the talus connects to the distal end of your tibia and your fibula. Okay, calcaneus is at the back, right? Okay, and that's the ankle that you feel on both sides. So the talus helps stabilize the ankle, basically. Okay, this bone protects the pituitary gland. We talked about that already. It's the sphenoid bone. And there's a groove at the top for the pituitary gland to sit into. That's it for the bone unit. Of course, there's the hormone stuff, which we'll review in a bit. Okay, next part. 3 glands that contributes to semen production. So there is the seminal vesicle, right, which secretes a fructose rich alkaline fluid. So it will help nourish the sperm and help neutralize the acidity in the female reproductive tract. There's also the prostate, which is also going to help adjust the pH and hence sperm motility. And there's one last one. Does anyone remember what the last one is? It's a rather long name, this one here. We have the prostate. That's good. There's one. What is that? Sorry.
Bulbourethral gland.
That's right. Thank you. The bulbourethral gland, or the Cowper's gland, right? Bulbourethral. So this one will flush the urethra to neutralize acidic urine. If there's any urine left in the tract, this will flush them before the ejaculation. Okay, list all the structure sperm passes through from testicle all the way until it comes out. All right, sure. So starting at the testicle, it will go through the epididymis, which would then goes to the vas deferens, the vas deferens will then go through the prostate gland. Think of like the prostate gland as an orange, and then like you stick a straw through the orange. That's pretty much what it's like. Okay, so the vas deferens will go through the prostate gland, through the prostate gland, and along the way, the seminal vesicle will add secretions to the mixture. And then it's going to go and transition into the urethra. And again, along the way, there's going to be the bulbal urethral gland. Okay. That's basically the path. Pretty straightforward. Here are some hormone stuff. List the trigger for GnRH. It'll be low. Well, okay, so in female, it will be high estrogen and low progesterone. Both would be the trigger for releasing GnRH. This one through positive feedback. This one would be lifting the negative feedback. For male, it would be decrease in testosterone. All right. Okay, next, list the function of FSH in male and female. So to keep it very simple, basically FSH is responsible for follicle development, right? Which forms the egg, so oogenesis. And then for male, that was female, sorry. For male, the FSH is going to trigger spermatogenesis. Okay. List the function of LH in male and female. So for female, it will trigger ovulation, right? Ovulation. And following that would be the formation of corpus luteum. As for the male, the LH will basically increase testosterone production. Okay. Because this one ultimately forming the corpus luteum will increase the production of progesterone, right? So testosterone is the is a male counterpart of progesterone. Okay, next. Functions of skeletal system. There are a bunch, so obviously provide support. For the body. There is hematopoiesis, which is formation of new blood cells. Mineral storage. Allows movement. Okay. Protection for organs. Right. So these are the major ones. I think we did this already. We're just gonna cross that out. Movable joints in the body. Describe the structure of compact bones. I'm just gonna briefly do that for you. So we have these concentric circles, right? Okay. What is this whole thing called? Does anybody remember the structural unit of a compact bone? Structural unit of compact bone. What do we call this thing? You would have a lot of them, right? In the compact bone. That's all right. This is a, sorry?
Is it lamina? No.
It's made up of lamina, yeah. But the whole thing we call an osteon, okay? Osteon. Thank you, Noor. So the calcified matrix that makes up the osteon is the lamina. Okay, so this is calcified matrix. And you will have these pockets, right? These pockets called the lacuna, which is where the osteocytes are found. Lacuna would have these cracks that comes out from it so that the bone cells can move around. Okay. These little cracks, they are called caniculus. Yeah, so it allows the bone cells to move around, which move around the lamina, which otherwise would have been pretty solid. It will be difficult to move around, right? And the central canal, that's where the blood vessel is going to be coming up. Okay, so that's like a blood vessel supplying the osteum. Okay. Just give me 1 second now. I'll be right back. Sorry about that. Just had to blow my nose. Okay, so that's the compact bone, okay? Describe in detail how PTH and calcitonin work together to maintain the homeostasis for blood calcium level. We did that a couple of times already. So I mean, we can quickly go through it again just one more time so you will be familiar with the process. So Basically, if you have increased calcium, then which hormone do we release again? Is it PTH or calcitonin? If you have high calcium level in the blood, let's think about it. Do we need PTH or do we need calcitonin? Okay, hopefully your answer is calcitonin. So the thyroid releases calcitonin. Okay, and it will lower calcium level by depositing calcium in bones and reduce absorption in kidneys. Okay. On the other hand, if you have low calcium level in the blood, then the parathyroid releases PTH. And that would increase calcium by increasing absorption from 3 places: from bones, kidney, and intestine. Okay, 3 sources for calcium.
Excuse me, Professor.
Yeah.
We got this question on the lab quiz.
Mm-hmm.
It says the function of parathyroid hormone is to increase calcium reabsorption into bone, decrease calcium in the blood, and then other are not related, like increase calcium in the blood, increase iron concentration in the blood.
Right.
So the not if like not decreasing and not increasing the calcium, what is the normal function of parathyroid then?
Let me quickly take a look at the question and see. Okay, I don't remember exactly what it is, but I can take a look quickly for you, okay?
Okay.
Anyone else had that question on the quiz, on the lab quiz? No? Okay. Who asked me that again? Sorry, I didn't quite catch the name.
Pesal.
Oh, Pesal. Okay, thank you. Give me a second, please. And then it was the PTH, right? Parathyroid gland.
Yes, Professor. It says the function of parathyroid hormone is to increase calcium reabsorption into bone.
Okay. I got the question. Yeah, I found it. Hold on. Give me 1 second. I'm just gonna pull that in here, okay? And thank you everyone else for waiting. Okay, so this is a question, right? The function of parathyroid hormone is to, yeah, you got it, increase calcium in the blood, right? So how is it going to increase the calcium in the blood? Well, it's going to do all these things, right? You're going to take the calcium from the bones, from the filtrate, from the intestine, and collectively, this would lead to an increase in calcium in the blood, right? Does that answer your question, or?
Yes, Professor. I was so confused while doing this.
The wording is, yeah, it's a little bit unclear, but ultimately, right, all these things, you know, I guess I understand your point. You're saying increased calcium reabsorption into the bone. Like that sounds like it's also the right answer, right? Yeah, I probably should change that because we're not increasing it into the bone, right? We're like taking it from the bone, I guess. And that's why this one will be the best answer. But thank you for bringing that up. Okay. All right. Next one. We did this one already, so we're not gonna go through it. I think some of it's somehow like repeating itself when I copy them over. So that one we did already. FSH we did already. Next one is estrogen and progesterone are both important for regulation of the menstrual uterine cycle. Describe specific effects of these hormones on the body during the menstrual cycle. So basically the estrogen will increase GnRH, increase FSH, and increase LH, right, through positive feedback. And at the same time, it will thicken the endometrium. And progesterone, in a way, it's kind of opposite. It will decrease GnRH, decrease FSH, decrease LH through negative feedback. And then it will also thicken the endometrium. Okay. Individuals with higher than normal level of FSH might be more likely to have non-identical twins. Explain why. That should be pretty self-explanatory. If you have high FSH, higher FSH level might result in more than one follicle being developed per cycle. Okay. This leads to 2 eggs being released. If both eggs are fertilized, then the person would have twins. Okay. That's that. Describe the interaction between the hypothalamus and the pituitary gland. We did this multiple times already, but we can quickly review it again. So hypothalamus produces ADH and oxytocin, which are stored and released from posterior pituitary. Whereas for the AP, the hypothalamus regulates the release of AP hormones through things like GnRH, TRH, and CRH. Okay. I don't think we talked about diabetes in our lecture, so you will not be responsible for it. In the body, hormone often work together using negative feedback as control mechanism. Give 2 specific example of feedback. We actually have a chart coming up later that will allow us to do this. Like over here, we're gonna do that afterwards. Describe in detail how insulin and glucagon work together to maintain homeostasis. we also had a chart for this last time. So maybe I'm not going to go through it again. Basically, insulin will, you know what, let's just write it down briefly for those of you who need a quick refresher. So if you increase glucose in the blood, then the pancreas, the beta cells in pancreas release insulin. Then it will promote cell absorption and liver will convert glucose into glycogen. Okay. So collectively, these two actions, the cell absorbing the glucose and the liver converting the glucose into glycogen, that will bring the glucose back down. On the other hand, if you don't have enough glucose, low glucose, say you skip a meal, then the alpha cells in pancreas will, I keep on spelling pancreas with a E at the end. Alpha cells in pancreas will release glucagon. And this only has one action. The liver will convert glycogen into glucose. Okay. That's it. Oxytocin is really is important for the letdown of the milk. Okay, so of course it's important for labor as well, but in terms of nursing mother, the oxytocin help the milk to come out, and the suckling action of the nursing baby will trigger more oxytocin to be produced and let the milk come out. Whereas prolactin, that's important for the production of milk. Okay. Describe the role of thyroid gland in maintaining homeostasis. I think we have a chart coming up to do just that. Okay, so let's fill in these charts together, starting with the male. So we have the hypothalamus releasing, you should know by now, GnRH. And then the anterior pituitary gland will release FSH and LH at the same time. These will travel through the bloodstream to the testicles, where you will produce testosterone, resulting in spermatogenesis. But the testosterone will go back and have negative feedback, right? For the female, positive feedback, of course, we're talking about the estrogen. So you will have GnRH as usual from the hypothalamus. The anterior pituitary gland will release FSH and a bit of LH, but FSH is the key one for the first cycle. That will go to the ovaries, and then you will release estrogen as the follicle is being developed. So that would lead to the thickens endometrium. And at the same time, it will go back and encourage the hypothalamus and AP to release more hormone. So that would be an example of positive feedback. Okay. So that is that. Let's take a look at the next one, the negative feedback. So same thing, GnRH, FSH, and LH. That would go to the ovaries and trigger the ovulation and eventually leads to the release of progesterone, right? Progesterone. It will again thicken the endometrium. But this time it would go back and inhibit the release of GnRH, FSH, and LH because you already have an egg in the system, right? Okay. That is that. Next one here, we have metabolism. So this time we are talking about thyroid releasing hormone, TRH, which allows the anterior pituitary gland to release thyroid stimulating hormone. Goes to the thyroid and trigger the release of T3 and T4. And it will increase metabolism. And we will have the usual negative feedback. Okay. The hyperthyroidism and the hypothyroidism, let's talk about that briefly before we do the stress one. So, one cause of hyperthyroidism is autoreactive antibodies. Okay. So here is your thyroid. The autoreactive antibodies will bind to the thyroid. Okay. And it will cause it to pump out large amount of T3 and T4. Okay. So T3 and T4 is supposed to go back and inhibit the release of TRH and release of TSH at the hypothalamus and the anterior pituitary gland, right? However, even though you have low TRH and TSH, which is supposed to cause T3 and T4 to come down, is not happening in the case of hyperthyroidism because the autoreactive antibody is permanently stimulating the thyroid gland. Okay, so the key thing here to know is thyroid continues to produce high levels of T3 and T4 despite low TRH and TSH in the body, right? Because of the presence of the autoreactive antibodies, your thyroid gland no longer requires the stimulation from TSH to produce T3 and T4. Okay, so even though there's no stimulation from TSH, TRH, it will continue to make a lot of T3 and T4. Does that make sense? The continuous stimulation of the thyroid by the antibodies will cause the thyroid gland to become big, and we call that goiter, right? Goiter. So that's that. For hypothyroidism, that is, again, have different causes, but let's say we have low iodine, right? Low iodine in our diet. Okay, iodine is needed to make T3 and T4. Okay, so here is your thyroid gland and then it's not able to make T3 and T4. So you have low T3 and T4 because of insufficient iodine in the system. You don't have enough raw material to make the T3 and T4. So what usually happens is if you have low T3, T4, then that's going to really stimulate TRH and TSH. Okay, so with the high levels of TRH and TSH in the system, it will strongly stimulate the thyroid. So the thyroid will also get big, person will get goiter, but thyroid does not make enough T3, T4, despite high levels of TRH and TSH. So it's the complete opposite, right? Look at what I wrote here compared to what I had before, right? And in the previous case, the thyroid keeps making more when there is no stimulation. And over here, the thyroid is not making any, even though there is a lot of stimulation. Do you understand the difference? So for hypothyroidism, usually the person would have high TRH, TSH, and low T3, T4. But for hyperthyroidism, it is the other way around. Okay. I hope that makes sense. Does anyone have any question before I continue? Okay. Moving on then. Stress. That is talking about the cortisol stuff. And so the hormones from the hypothalamus would be CRH, which triggers the anterior pituitary gland to release ACTH. This then goes to the adrenal cortex to release the mineralocorticoids and the glucocorticoids, but the one we'll be focusing on is cortisol, and that will increase resource availability. And normally there is going to be the negative feedback, but as we discussed last time, this negative feedback can be overridden by your central nervous system if the person is experiencing chronic stress. Okay. That's all. Okay. Here's another chart. Complete the following chart with the proper antagonistic hormone pairs. So by now you should know we talk about normal levels of sodium in the blood. So increased level of sodium will cause the release of ANH from the heart. And through the mechanisms that we talked about, right, acting on the kidneys, suppressing renin and the RAS system and aldosterone, it is going to decrease the level of Na+. On the other hand, if you have decreased level of sodium, we will release aldosterone, which through its action in the kidney will bring sodium back up. So that's one of the three antagonistic pairs that we talked about. And hopefully you know the other one is calcium. Calcium. So when you have increased calcium, the body will release calcitonin, which brings the calcium back down, right, through the action at the bones and at the kidneys. And as we mentioned earlier, if you have decreasing calcium, Then you will release PTH, which will bring the calcium level back up. And the last one in the trio here is glucose. Increased level of glucose will release insulin, which will bring glucose back down by telling cells to absorb it, as well as converting some of it into glycogen at the liver. When you have a drop in glucose, then we will produce glucagon from the pancreas, which will bring the glucose level back up. Okay. So that's that. Okay, we will quickly do a bunch of polls here and see what the answers for these things are. Okay. So let's go. First one. These only have one answers, by the way. Good, everybody got it. The pancreas and the adrenal gland is located in the abdominal cavity. Very good. Next one. I'll do this one. This one is pretty straightforward. A decrease in blood sodium level stimulates the release of aldosterone from the adrenal cortex. This is an example of hormonal control. Okay, the other ones doesn't make any sense. Number 3, I'll do the easy ones. Okay, I'll let you guys do the harder ones. The hypothalamus controls the anterior pituitary gland by producing, we talked about this multiple times already, through releasing hormone and inhibiting hormone. It's just that we didn't learn the names of any inhibiting hormones, right? But they're there. Okay. Let's try number 4, please. Okay. It's kind of all over the place here. Let's take a look. The correct answer is C. That's the one that is not true. Because oxytocin is not produced by PP, right? Oxytocin is produced by hypothalamus. It's just being stored and released from the posterior pituitary gland. Everything else is true about the oxytocin. Okay. Given the lack of participation, I think I'm just going to take them out. Okay, so I don't take up too much of your time. Which of the following hormones will affect another endocrine gland? So we're asking for the tropic hormones, and you know, we have TSH, ACTH, and GnRH. All these will affect another endocrine gland. So it's all of the above. Okay, GnRH, of course, affects the anterior pituitary gland. Right? The pituitary hormone ACTH will stimulate the adrenal cortex. That's what the AC is, right? Adrenal cortical. Will stimulate the adrenal cortex to release aldosterone and cortisol. Which endocrine gland produces the greatest number of hormones? Okay, maybe I'll let you try this one as well. I just want to see if people know this, like which one has the most hormones. Yeah, good. Okay, most people got it. The answer is the anterior pituitary gland. It has like a total of 6, right? That we talked about. The adrenal gland only has, if you count the cortex and the medulla together, it's only like 4, right, in total. Okay, what is the target organ of T4? Right? So T4, T3, and T4 are responsible for metabolism. So there's no specific organ. It's most of the cells in the body. What is the function of T4? It increases the metabolic rate. Okay, same as T3, of course. Which hormone is needed for thyroxine or T4 production? So if you think about the pathway, right, to stimulate the release of T4, we need thyroid stimulating hormone. Which of the following is not a target organ of parathyroid hormone? Parathyroid hormone is needed to bring calcium level back up. It will take the calcium from bones, from intestine and kidneys, but not muscle. Which of the following is not true for glucocorticoids? So glucocorticoids is basically talking about things like cortisol. That's the only one that we've learned. And what that does is it will increase the resources availability in general. So promotes the metabolism of fatty acids instead of carbohydrates. That's something that it will do. Promotes the kidney absorption of sodium. That's not the function of glucocorticoids. That's the function of aldosterone. Aldosterone, which is a mineral corticoids. Okay. Next, cortisol reduces inflammation, pain, and swelling. That is true. I told you in the lecture that those acne creams, they actually contains cortisone, which is like the medicine version of the cortisol, right? Because of its anti-inflammatory property, it can be used to treat arthritis, but it will also suppress the immune system. That's why it reduces inflammation, right? Through suppression of the immune system. So it is all of the above. Insulin results in most cells taking up glucose. That's correct. But let's keep reading. Fat cells making more fat, converting glycogen to glucose. Most cells taking up glucose and fat cells making more fat are correct. Yeah, that's the one. Okay. Converting from glycogen to glucose, that is the function of glucagon. What is the stimulus for release of insulin? Okay, that is when you have high glucose in the body, like after a meal, right? What are the target tissue for glucagon? The glucagon is going to basically targets the liver, as well as the fat tissue. It's like the backwards, right, of what insulin does. I'm gonna take some glucose from your fat reserve. Stimulus for glucagon is low glucose level. Next one, the epididymis, the thing that sits on top of the testicles, stores the sperm and allows them to mature. Which of the following is not part of the duct system, as in like the sperm doesn't physically travel through it? That would be the bulbourethral gland. Seminal vesicle would also not be part of the duct system. Okay. The vas deferens joins a duct from the seminal vesicle to form the ejaculatory duct. If you look at the diagram of the male reproductive system, you will see it. The ejaculatory duct joins the, so this is just like asking the same question, but backwards. Okay, the urethra. Which gland secretes mucus-like fluid that helps lubricate the end of the penis for sexual intercourse? That would be the bulbourethral gland. Which of the following stimulates spermatogenesis in the seminiferous tubules? That would be FSH. Development of fetus occurs in the uterus. The female is pregnant when HCG is present in the blood. HCG, what does it do? Well, it maintains the corpus luteum until placenta is producing its hormone. We need the progesterone level to be continuously high to keep the fetus safe while wait for the placenta to fully develop. We can use HCG for pregnancy detection. And it also keeps new follicles from developing, because if the corpus luteum is maintained, then progesterone level is high, and high level of progesterone is going to suppress FSH, right? So you won't have a new follicle develop. And we don't want that to happen anyways, because the person is already pregnant, right? So we don't need another egg. So all of the above. So that is it for the review. I'll post the information for the test shortly on eCentennial. And that's it for the whole semester. I want to thank all of you for, I recognize all the names here that are here today at the tutorial. You guys are always very on time, and you guys always come to the tutorial. So I thank you for your dedication and commitment. And I wish all of you the very best as you move on to the next program. So yeah, thanks again. And take care, everyone, and good luck on the final test. Bye for now.